Jacob, how's it going? My name is Kevin. I'm a senior physical therapist working under Dr. Clausen. So today we're going to be performing high frequency conventional TENS. TENS stands for transcutaneous electrical nerve stimulation. Today we're going to be using it for pain control. So Jacob over here has osteoarthritis. He's reporting about a 5 out of 10 pain. So what we're going to be using the TENS for is for what we call gait control theory. What gait control theory basically is we're going to be stimulating the A beta nerves to inhibit the A delta or C nerve fibers from bringing that pain up to the brain. So that we're going to be putting electrodes on both sides of the knee so that that current flows through, and that will basically work that gait control theory. Okay. So there are contraindications for using TENS. The main one right now that we want to be looking out for is desensitized sensation to around the area that we're going to be putting the electrodes on. There are of course other contraindications, such as if this was a female and she was pregnant, we definitely want to avoid that area. If they have a pacemaker, if they have like a history of blood clots or anything like that. So Jacob, do you? I'm just going to be touching around this area. I just want you to let me know if you feel any sensation. Okay, can you feel this?
Yep.
Yeah.
Yep.
All right. Do you have a history of any blood clots or anything like that?
No.
No. Perfect. So, right now, Jacob, what we're going to be doing is I have our TENS unit set up right over here. We're going to be placing electrodes on both sides of the knee just so that current flows through, and basically we're going to be blocking some of those pain nerves from getting sent up to your brain. It's going to be like a comfortable kind of tingling, or paresthesia, just so that it feels good. You shouldn't feel any pain. Okay.
Awesome.
So I'm going to be placing the electrodes on right now, if that's okay.
Yep, that's cool.
So I'm going to be placing on both sides of the knee. I'll be placing one right over here and one right over here. You okay?
Doing well. Alive.
Awesome. So, if Eric, you want to come over here, just going to be setting the parameters for our TENS unit. So we're going to be doing a biphasic, the symmetrical biphasic pulse current, continuous. We're going to set the frequency up to 100. And we're going to set the width to 100 as well. Okay. Continuous. And we're going to just be leaving it on for about 30 minutes. And I just want Jacob to let me know. Jacob, you're going to start to feel some tingling. I just want you to know when it's like at a comfortable tingling, as much as you can tolerate. But we do not want like a muscle contraction or anything, okay? So I'm going to be starting it. So I'm just turning up the amplitude right now. I want to go kind of quickly. What are you feeling?
Nothing yet.
Nothing? Okay. Yeah, so the reason we set the pulse duration to 100 and not greater than like 200 or anything is because we just want that paresthesia, but
Definitely
we do not want
right there.
muscle contraction. Around right here?
Yeah.
Yeah, feels okay?
Yes.
So we're going to start it. We're going to be leaving it for about 30 minutes or so. Okay, 30 minutes has passed. So I'm just going to be stopping the machine right now. Jacob, how are you feeling?
Pretty good.
Pretty good? Awesome. So I'm just going to be taking off the electrodes just to check the skin. Make sure that there is nothing going on. Okay, that looks good. And over here. Perfect. So when we started this, you mentioned that your pain was at a 5 out of 10, right?
Yeah.
How are you feeling right now?
Definitely improved. Probably like 2.5, maybe 3 out of 10. So I'm pumped. It's not as bad.
Yeah?
Yeah.
Feels good?
Yeah, absolutely.
Awesome. I'm glad. All right. That's all.